Welcome to 1071st day of continuous and uninterrupted Zoom session of IFPH. Let's start today's program with silent prayer. Yes, sir, please.
I'm trying to make you the host, sir.
Yes, sir. So today our guest is a familiar face. We all know that. She proved her potential with a few presentations in IFPH. Dr. Shalini, graduate from Government Medical Homeopathy Medical College, Bangalore, 2009. Certificate course in Children Health, CGH. Certificate course in Obstetrics and Gynecology. Certificate course in Skin and Venereal Diseases. Then a lot of explanations are there. And the topic is World Breastfeeding Awareness Week celebration and its homeopathic remedies. We all know that perhaps homeopathy is a law system which approved the most suitable method of administering homeopathic medicine is through the mother's milk. So that's the most important thing. On behalf of IFPH, I am welcoming Dr. Shalini. You can have the platform for next 45 minutes. It's over to you, please.
Okay, so thank you so much for giving me an opportunity to present today's World Breastfeeding Awareness Week. Thank you so much, sir. So as we all know, like from August 1st, every year from August 1st to 7th, the first 7 days, the first week of August is celebrated as World Breastfeeding Awareness. So now I'll be sharing the slides.
Yes.
Yeah, is it visible, right?
Yes, yes.
Yeah. So August 1st to August 7th, the 7 days, the first week of August, every year is celebrated as World Breastfeeding Awareness Week. So we all know that like when a child is born on the earth, the first feed which is given to that baby is the mother's milk. That is the nature's God's milk, which contains all the nutrients, vitamins, minerals, so which makes the baby to grow. So like we have to know the awareness about this breastfeeding, because in some villages, in remote areas, people will be not knowing the importance of breastfeeding. So the national program is of the breastfeeding awareness. So we, the citizens of India, as a doctor, it is our responsibility to spread the awareness about the breastfeeding to the people. So, today is the last day of the breastfeeding awareness program. So I'm very glad that today I'm presenting this topic. So as we all know, like the one drop of the milk, the mother's milk, which contains water. You can see in the slide, it contains water, protein, carbohydrates, lactose, and various essential fats, and it contains antibodies, vitamins, minerals. The human milk, the mother's milk is a very important to the baby because it contains all the nutrients, vitamins, which is essential for the baby to grow. It contains immune cells, hormones. So like when the mother give birth to a child, the first milk which is produced, it is a color of orange or greenish color, and medically it is known as colostrum. So this colostrum in some of the villages, like some people, they don't know the importance of this, the starting stage of milk, because it is not of white color, and some people will not give this milk to the baby. But this yellowish greenish color first milk is very important because it contains all the nutrients which help the baby to overcome many diseases. Like it will prevent the SIDS, means sudden infant death syndrome, is prevented, and it helps in the baby's growth. Like it will overcome or prevent diarrhea, vomiting, or fever, or any other diseases. So this first milk of the mother, which is called as colostrum, is very important. So you can see the other slide also. 90% of the mother's milk contains water, fats, lipids, fatty acid is present carbohydrates, lactose, oligosaccharides, proteins, casein, whey, lactoferrin, vitamins, minerals, hormones, antibodies, stem cells, and enzymes. So all this contains only in the mother's milk. So the mother's milk is given for 6 months into the baby, and after 6 months, along with mother's milk, the other smashed food like rice or chawal is smashed, and fruits is smashed, and the food is given along with mother's milk after 6 months. So this mother's milk is given for 2 years, first year and first year of the baby and second year, and in some places it is given more than 2 years also, like 2.5 years or 3 years also it's given. And it is very good, because when the mother gives the milk to the child, mother is also benefited by this, because it prevents her from breast cancer, ovarian cancer, and when the delivery takes place, the cervix, uterus come back to its normal position because of feeding to the baby. And many cancerous diseases are prevented by giving the breast milk, and it will help in losing the weight also. When she starts giving the breast milk to the baby, her weight is also slowly reduced, and mainly it acts as a contraception, because when the mother gives the breastfeed to the baby for 1 year or 2 years or 2.5 years, it acts as a contraception, like her giving birth to another child is also prevented. So breastfeeding is very important to the mother and also to the child. Now we'll see the positions of breastfeeding. So these are the 5 types of breastfeeding position. The first one is, I think you can see the slide properly. The first position is called the cradle position. This is the universal position when the baby when the baby is holded on the left hand or on the right hand. The when the mother holds to the left side, the baby left head is towards her shoulder. You can sorry, to the elbow. You can see it in the picture. And she gives the support of the left hand on the back of the child, and the right hand is supported to the hips of the child. So this is known as cradle position. This is the universal position where the baby is supported by the left hand, or when the baby is holded on the right hand is supported on the baby's back, and the left hand is supported to the hips. So this is known as the cradle position. This is the universal position which helps the baby to suck the milk properly. So there is no like when the mother is feeding the baby, there is nothing required, like she has to take extra calories of food or nothing is like that. And there is no like a time limit or time gap, nothing. Whenever the baby wants the milk, she can give the milk as frequently she can give it. And by giving the breast milk, her breast that hardness, everything is prevented, and the baby sucks the feed or the breast milk properly. So the bonding between the mother and child is formed by breastfeeding. So the first one is the cradle position, and the second one is the cross cradle position. In this position, when the baby is holded on the left side, the left hand is supported to the head of the baby, and the right hand is supported below full. So you can just tilted above. So you can see in the picture, it is cross cradle position. If the baby is holded on the right hand, the left hand is supported to the head, and the right hand is supported to the back. So you can see it is the cross cradle position. Even this is very important. The mother enjoys the feeding to the baby, and the baby also enjoys sucking the breastfeeding. And the third position is called the football hold. In the football hold, when the baby is holded and to the right side, like see in the previous position, like in the cradle position, in the cross cradle position, the baby was holded tilted above, but in the football position you can see the baby is holded below. So the baby enjoys taking the feed, and even the mother also enjoys giving the feed, and the mother and child bonding is improved or nourished. And as I told, all the benefits are taken by the mother and the child. So this is the football hold. And the fourth one is laid back position. In this position, the mother lies on the bed and the baby is holded to the breast on the right side or on the left side. So this is laid back position. And the last one is the side lying. Means the mother like lying down, her head is tilted above. You can see in the picture. That is the side lying. And the baby is holded on the right side or on the left side. That is the side lying. So these are the 5 breastfeeding position. We have to give awareness to the mother so that she gets the awareness about this holding position. And by this holding position, the baby like doesn't get choked. Like when the baby is getting feed, and when it gets choked, it will start coughing. No, by giving awareness about this position to the mother, she will hold the baby properly, and the feeding is given in a proper position. So these are the 5 positions of holding the baby, and it's very important if we give this awareness to our family members or our relatives or friends. So this is very important. So these are the breastfeeding position. So now we can see how to do breastfeeding, like the nipple and the baby's mouth position. So you can see in the picture, in the first picture, the nipple is towards upper side, and the baby sucks the nipple properly. So the nipple along with the areola region has to be pushed inside the baby's mouth, so that in the second picture you can see the milk is flowing and it can suck it and swallow it in the second photo. And in the third photo also you can see the nipple is inside the baby's mouth, and it is swallowing the milk in the 4th, 5th, and 6th. So these are the position or holding position of the breast, nipple, and the baby's mouth. So this is very important. So this is the slide about holding the baby position for the breastfeeding, and holding the breast, nipple along with the areola to the baby's mouth, and helping it to swallow the milk properly. So these are about the position. So now we'll know the benefits of breastfeeding to mother and child, as I have already told. See, it nurtures the maternal bond between mother and baby. So when this breastfeeding is done, there is a bond between mother and child is built. So that is very important. So the baby feels safe in the mother's hand, and it reduces anxiety and depression related issues in the mother. So when the child is born, there is hormonal imbalance. So the mother may be stressed or anxiety is related, but when she gives milk to the baby, her stress levels are reduced. So it minimizes the stress levels. and it sensitizes mothers to her baby's needs. So when the baby needs the feeding, like we can make out like the baby's started crying or behaving irritability. If you observe that, then the mother gets the baby is hungry, so I have to feed the baby. That is the nature, that is the natural behavior of the baby, and it promotes calmness and confidence in the mother. And the main thing is it acts as a contraception to the mother. It prevents breast cancer, ovarian cancer, uterus cancer, and other diseases to the mother. And in the child, it reduces or prevents diarrhea, cold and cough, flu, or any seizures, or fever is prevented, and SIDS, that is sudden infant death syndrome, is prevented. And it induces healthy sleep in the baby as well as in the mother. And we can see in some children, they will be the whole night they will be awake, and the whole morning they will be sleeping, and it is natural process. And there is no need of taking extra food, or because of the calorie given to the child, there is nothing. She has to take the nutritional food like morning, afternoon, evening, night, the mother's food is given to the mother, and the child is given the breast milk. See in the slide, you can see breast milk is a unique combination of nutrients essential to the child's health. Breastfeeding satisfies baby's emotional needs, and the bond is built between mother and child. Breastfeeding results in less sick days for parents. It can give you a great sense of achievement. So when the mother feeds the baby, she feels a great sense of achievement. Motherhood is a God gift, and so she feels a sense of achievement. Breastfeeding in a child protects the baby from infection and diseases, and there are less chances of diarrhea and vomiting. And natural food designed for the baby, it makes nappies less smelly. So when the baby is taking the mother's milk, the nappies smell is reduced. And when the baby is taking the feeding properly, we can notice it by the baby, its urine and the stools is passed frequently. That is that shows that the baby is healthy, and they have healthier brains, they have better skin, the babies have better vision, they have fewer ear infections, means ear infections are prevented. They are less likely to die of SIDS, that is sudden infant death syndrome, and there is less chance of developing eczema. It lessens the risk of being an obese later in life, means it prevents the mother to become less obese in the future. Okay. You can see this again, the benefits of breastfeeding for babies and mother, like ideal nutrition for infants, enhance the immune system of your baby, prevents childhood malnutrition, including wasting of muscles, protects children from deadly infections, and for mother, lowers the risk of breast cancer, ovarian cancer, and type 2 diabetes, help you lose pregnancy weight faster, saves your time and money, creating a bonding between mother and baby. And very important is it acts as a contraception to the mother. Stress levels are reduced by breastfeeding. So, these are the benefits of the breastfeeding. So it's very important. Now we'll deal with the what are the homeopathic remedies to which, in some mothers, after the childbirth, she may get less breast milk, or other cases, like when the breast milk is not produced properly, or what are the conditions and what are the homeopathic remedies for this less breastfeeding. So homeopathic medicines are very effective to improve milk supply during breastfeeding. They help in enhancing milk supply naturally by treating the medical reasons behind it. Some of these medicines not only help to boost breast milk production during lactation, but also helps to improve its quality. Though these are entirely safe to use, but one must take the proper supervision and guidance of a homeopathic physician who will suggest the medicine name, dose, and reputation based on every individual case analysis. Yes. Like in some others, if the nipples are cracked or cracked or dry, also no problem. She can feed the baby, so there is nothing harm in that. If the mother has HIV, then she's not supposed to feed the baby. And if the mother has fever or cold and cough, then also she can feed the baby. Like it will not get transfused to the baby. Okay. The very important homeopathic remedies, the first one is the very beautiful remedy, as we all know, it's pulsatilla. Pulsatilla is a very important remedy because it is given when the milk quantity is scanty, when the milk quantity is thin and watery. Homeopathic medicine pulsatilla is prepared from the plant Pulsatilla nigricans, commonly known as pasque flower or windflower. This plant belongs to family Ranunculaceae. It is valuable medicine to increase milk flow when it is little in quantity, thin, watery, and lacking true milk globules. Swelling of breast may be present. Females needing it may have mild sensitive nature with weeping tendency. They weep every time a child is put to breast. So this pulsatilla remedy is given to females who weep, who have weeping tendency. As we all know, like the mentals and the complaint has to match. When the mother has a weeping tendency and when she is very sensitive, so when the milk is quantity is scanty, thin and watery, when this pulsatilla medicine is given, it acts as a beautifully, because it acts very effectively and it helps in increasing the breast milk. So pulsatilla is a very important remedy and it helps in the case of scanty milk. And the next remedy is the chamomilla. Chamomilla is given to the patient who has the irritability tendency to establish flow of milk when absent with sore breast. The patient complains with sore breasts, and it is very helpful medicine for increasing breast milk. When the patient is of irritable tendency and when her breasts are sore and when the milk is absent, chamomilla acts as a very good remedy. It is indicated for women who have soreness of breast and absent milk. The breast may be hard and tender to touch. She says, or when we do the examination of the breast, and when the breasts are hard and it is very tender to touch, and irritability is present in the mother, and there is drawing pain in the breast, can be present too. With this, they may have profuse lochia, vaginal discharge that occurs after childbirth. It is also indicated when there is suppressed milk from the anger spells. See, in the chamomilla, the beautiful remedy, when the mother, the characteristic symptom is irritability and anger spells are there. And when she gets profuse lochia, so when there is a vaginal discharge occurs after the childbirth, and when the breasts are sore, and when it is hard to touch, so when she has a tendency of anger and irritability is present, chamomilla medicine is prescribed in the depending on the case, in the potency of 30 or 200, and this remedy acts wonderfully in increasing the breast milk. So chamomilla acts very beautifully. The next remedy is the Artica urens. Artica urens is very important for the cases when there is complete absence of milk, which is called medically as agalectia. with pain. This medicine is prepared from the plant known as small stinging nettle. This plant belongs to family K.A.SHALINI. This medicine is considered in cases in which milk is entirely absent after childbirth. Along with this, pain of burning, stinging nature is present in the breast. Swelling of the breast is also present. In such cases, this medicine helps in establishing milk flow and relieves breast pain. There may be a history of a lump in the breast in the past in the cases needing to feed the baby. So when the patient comes with a history of lump in the breast in the past, and there is a complete absence of milk, that is agalactia, means there is not even one drop of milk is coming from the nipple. So this Artica urine medicine acts wonderfully in helping the mother to get the breast milk, and it helps in the feeding of the baby. And the next very important remedy is the ricinus. To enhance the milk flow, this medicine is given. It is a natural medicine prepared from plant Ricinus communis, commonly called castor oil bean, that belongs to the family Euphorbiaceae. The leaves of this plant have very strong action on female genitals and breasts. It's used for enhancing milk supply, have been done since ancient times. So this medicine has been prescribed since ancient times, and there are records by Hale that in ancient times in the Cape Verde Islands, the leaves of this plant were applied on the breast of the females after childbirth to boost the flow of the milk. Homeopathically, this medicine is effective as oral medicine to enhance milk flow in nursing women. So in the olden days or in the ancient days, this resinous leaves were applied on the female breast because it helps in enhancing the breast milk. So in homeopathically, this medicine is given in the oral like dilution form to the pills, and when this medicine is prescribed to the female patient, it enhances the milk flow. So ricinus is very important remedy in breastfeeding. The next is a very important lactosa virosa, galactogogue to stimulate milk production. This medicine is prepared from the plant Acrid lettuce of family Compositae. As per Dr. Boric, this medicine is a true galactogogue, herbs and medicine that helps to increase breast milk flow in lactating mothers. In cases needing it, there can be agalatia, means entire absence of milk in breast. When there is complete absence of milk in the breast, so this lactosa virosa acts wonderfully by enhancing or improving the breast milk in the female patient. So this remedy acts very beautifully, and Dr. Boric has said that this is a true galactogogue which helps in increasing the breast milk in the lactating mothers. And the next important remedy is lecithinum, another galactogogue to increase milk supply. Lecithinum is another prominent homeopathic medicine which acts as a galactogogue to increase milk supply. In addition to this, it also makes the milk more nourishing and nutritious. Means this remedy lecithinum acts as a nourishing factor and a nutrition, and it makes the milk more nourishing and nutrients to feed the baby. Okay. The next constitutional very important remedy is the bryonia for inflamed breast with suppressed milk flow. This medicine is prepared from the root of the plant Bryonia alba, commonly known as wild hops. This plant belongs to the family Cucurbitaceae. It is very beneficial for cases having inflammation of the breast, that is the mastitis with suppressed milk flow. The breasts are swollen, hard, heavy, with scanty milk secretion. Where it is required, this medicine is given. And there is a burning, tearing pain in the breast is also present. Nipples can be very hard with this. Other than above, it is also useful for cases where lumps in the breast are there with retarded milk flow. So this Bryonia medicine is given when the breasts are inflamed and suppressed milk is present, and there is a burning, tearing pain in the breast is present. So this medicine or the homeopathic Bryonia alba helps in enhancing the milk, and when there is a lump in the breast is also present, and when the flow, when there is a flow, milk flow is reduced, this Bryonia alba helps very effectively in lactating mothers. The next remedy is the alpha alpha. To improve the quantity and quality of the breast milk, this alpha alpha medicine is used. This medicine is prepared from the plants called Medicago sativa, California clover, or lucerne. This belongs to the family Papillonoideae. It is very effective medicine to improve the quantity and quality of the breast milk. Additionally, it is a great tonic to increase energy, stamina, and give strength to the body. So after the delivery, when the female patient, when the mother has lack of energy, or when she feels low, this alpha alpha helps in the quantity and quality of the breast milk. Along with that, it increases the energy, stamina, and gives strength to the body, which helps in the breastfeeding of the mother. The next important homeopathic remedy is the asafoetida. For re-establishing milk flow when it has dried, this medicine is prepared from gum resin of the living root of the plant, gum of the stinkacine. This plant belongs to the family Umbelliferae. This medicine carries a great ability to re-establish milk flow in cases where it has dried up a few days after delivery. So when the female patient comes to us, and when starting days feeding is there, and when it gets dried up, females who may have a very sensitive nature. Means asafoetida patients are very sensitive, and when there is dryness after feeding for some days, so this asafoetida acts very effectively in the lactating mothers. And the next very important remedy is the lac defloratum. This important remedy helps in improving the milk secretion. This medicine works very effectively to improve the milk flow. It produces the milk. It quickly helps to bring milk flow in a few hours or a day. Females who require it may have decreased in size of the breast, and some lactating mothers who have decreased small size of the breast, this lac defloratum is given, and this enhances or improves the milk secretion, and it improves the secretion of milk, like every half an hour or few hours, the milk is produced, or it is improved to give feeding to the baby. And the next very important constitutional remedy is called the Calcarea carp. For cases having scanty milk with hard and distended breast, this medicine offers help when the breast is hard. So this is characteristic when the breasts are hard, distended with scanty milk flow. Nipples may be hard with this. Stitching pain in the breast can be felt when the child nurses. So when the lactating mother comes to us with the Calcarea carp constitutional remedy, so she'll be having a scanty milk and hard breast, and there is distended breast. So with the scanty milk flow, when the nipples are very hard to this, so the Calcarea carp is given, which helps in improving the breast milk in the breast, and it helps in feeding the baby. And the next very important remedy is called the causticum. Causticum is given when there is suppressed milk flow from the fatigue or anxiety. It is a wonderful medicine to trigger milk flow when it has been suppressed from fatigue or anxiety. Females who need it also have complaints of cracked nipples. They also have intense itching about the breast. Pain in the breast during the nursing can also be felt by them. So causticum is very important remedy because it acts for the milk flow along with the fatigue or anxiety. So this causticum medicine is given. This is about the homeopathic remedies, and today I'm just I'll be asking regarding the breastfeeding a small question and answers. So I'll be asking, hope you enjoy this session. So shall I start with the breastfeeding quiz questions?
Oh, yes.
Yeah. Okay. The first question is, the question will be asked, and along with it, 4 options will be there. So you can just see the answer. The first question is, the breastfeeding children are less likely to have option A, diarrhea, option B, ear infection, option C, pneumonia, option D, all of the above. So I'm getting many answers. Okay. Okay. The correct answer is all of the above. Yeah. The correct answer is all of the above because the breastfeeding children are less likely to have diarrhea, ear infection, pneumonia. So the correct answer is all of the above. Okay. The second question is, breasts are engorged, hard, hot, inflamed, pain is stitching as opposed to red and throbbing. You can guess it. You can just guess it.
Yes, Dr. Shalini, did you finish?
Yeah, no, sir. Actually, I got exit.
Yes, yes.
Okay. The second one is answer is B, Bryonia alba. Okay. The third question is, how does breastfeeding help the child parent? Option A, breastfeeding helps you get back to your normal weight. Option B, breastfeeding reduces your risk for ovarian cancer. Option C, breastfeeding increases bone strength. Option D, A and B. Yeah, the correct answer is D, option A and B. Okay. The fourth question is, breasts are inflamed, lumps present, abscess, nipples are cracked and sore, nursing is painful, pain radiates from nipple into the rest of the breast and body. This remedy can take 12 to 24 hours to take effectively. Option A, Cilicia, option B, Naxomica, option C, Phytolacca, all of the above. Okay. Answer is option C, Phytolacca. Answer is Phytolacca. Okay. Which is the, yeah, okay. Option C, Phytolacca. Fifth question, which is the most important hormone your body uses to make breast milk? Option A, estrogen. Option B, prolactin. Option C, progesterone. Option D, insulin. Yeah. Correct answer is B, prolactin. Yeah, it's a correct answer. Okay. Sixth question. Breasts inflamed, painful, lumpy, nipples cracked and inverted, abscess, pain in breast is sharp and worse while nursing, worse in the left side, also may have an aching back. Options: A. Asafoetida, B. Cilicia, C. Calcarea carp, none of the above. Okay. Any other? Okay. Yeah, correct. Option B, Cilicia is the correct answer. Very good. Yeah. Okay. The seventh question is, how often does a breastfeed baby eat? Option A, 3 times a day. Option B, 6 times a day. Option D, 8 to 12 times a day. Option D, 20 times a day. Any other options? Yeah. Option C is the correct answer. 8 to 12 times a day. Yeah. Okay. Eighth question. Oversupply, emotional, VP, depressed. Option A, pulsatilla. Option B, bryonia. Option C, ignatia. Option D, all of the above. Yeah. Yeah, very good. Option A, pulsatilla is the correct answer. Okay. Ninth question. How many extra calories a day should you eat when breastfeeding? Option A, 100. Option B, 200. Option C, 500. Option D, 1000. Yeah. Any guesses? Yeah, very good. Option C, 500 is the correct answer. Okay, the last question. Okay. Oversupply of milk, breasts feel large and uncomfortable. Option A, Calcarea carp. Option B, Del Camera. Option C, Conium. Option D, none of the above. Yeah. Option A. Option A is the correct answer. Option A, Calcarea carp is the correct answer. Yeah. See, this is the breastfeeding awareness in one of the garments factory. Like for the females, I conducted breastfeeding awareness. Like these questions were asked to them also, and I explained about the baby's holding position and the like the question and answers, like options were also given, and I like that awareness program was given in that garment factory, and it's a very important, and like I felt very happy giving the awareness program to that factory ladies. So thank you so much. I hope you enjoyed this session of World Breastfeeding Awareness. Thank you so much, sir.
Yes, it is a really nice presentation. With the last part of the quiz program is also very interesting, and it is very important that these young people are really thinking a lot. They are working hard for development of homeopathy as well as their profession. The important thing, as I initially said about that, the homeopathy is maybe the lone system of medicine which advises the route to administration of medicine as breast milk. As Sariman rightly said, sucklings never receive medicine. Instead, the mother or the vet nurse, through them, the medicine will act more quickly, mildly, and beneficially. So 3 sentences are used there. That is the methodology writings of Hahnemann. It is more quick, more mild, and more beneficial. This is what a physician is in fact needed. So it's time for discussion. Those who would like to participate, please go to the participants and raise your hand. Anyway, Dr. Shalini explained a lot of things and brought to attention the important aspects of the breastfeeding and the preventive aspect. Then the position, various positions that should be adopted for breastfeeding. But one thing we must remember that breastfeeding in a recumbent position may lead to an ear condition, ear infection, the chronic suppurative uterine media. Because through the eustachian tube, the milk will reach the middle ear. So that is an important thing. So it is always better to feed the baby in sitting posture. Don't forget about that. That's the most important thing. Then again, when you said about the preventive aspect of this breast milk, it has got this property, that property. Okay, that's all right. But we must remember about the health of the mother.
Yeah.
Yes, it is all these things are conditional. If she got some depression, some emotional disturbances, problems, then it's always better to avoid breastfeeding. Otherwise, the child will get some problem, including epilepsy. Convulsions may be there. It can happen as a result of this. So these advices, you should. That is why Haniman always says it should be forthwith with reasons. Your advices should be always circumspection, tact, knowledge of human nature. All these things are very important. So it's a nice presentation, and what is more important is at last you did conducted some public awareness programs. Well, these are the areas where homeopathy is the most practical system of medicine. You just said about around a dozen of medicines. How many others? How much medicines are there on the other side of medicine? That too, safe medicines that can be administered with ease, and that is more important and more beneficial not only for the mother but also for the child. So that is most important. Then you said about the different position. That's very interesting. Then must think about the contraindications also. That is also described nicely. Then the medicines Asafoetida, Lactifloratum, Calcareum, the Lactusa, then Lecithin, Trionia. A lot of medicines are there. So the Artica urans, another medicine, the Resinus communis, Pulsatilla, Chamomilla. There are a lot of medicines still to come. From A to Z, medicines are very important. If Ignatia, phosphoric acid, causticum, natramor, why not? Yes.
Yes.
Then regarding the potency, I think the high potency is very, very important here, because at that time during the pregnancy period as well as this lactating period, the vitality of mother will be she is really more sensitive. Isn't it? Am I right?
Yes.
Then
Yes.
another thing we must remember that some medicines administered during or giving the anesthesia during cesarean may cause a kind of this depression.
Yes.
That's the most important thing. Unfortunately, because it may be labeled as dowry problem. In fact, she is herself in problem with her this psychiatric problems following the administration of this medicine for anesthesia. But the unfortunate husband and his family will be crucified because the lady committed suicide because of this dowry problem, but in fact due to this psychological problem. So those who would like to participate, you can share your experience. Yes, Dr. Shaji, do you have something to say, or for preparing for the next important session?
No, sir. There are other important homeopathic remedies also which acts for this enhancing the breast milk. But these were the few remedies which will help in breastfeeding. So I gave importance to these medicines, and I presented today.
Then what about the potency, the administration, those?
So depending upon the case, like 30 potency and 200 potency. So 30 potency is usually we prescribe. So 30 potency will act in a very effective way. 30C.
Yes. So also the dieting regimen is also important.
Still?
Then again, the number of times that is conditional. We know that certain medicines like iodine, voracious kind of sina, voracious kind of appetite.
Yes.
Isn't it? Am I right?
Yes, sir.
So when you are a homeopathic physician, you should apply the logic in your
Yeah.
own way. So don't say give the breastfeeding 10 times, 20 times, or 12 times. It depends. Depends upon the individual, the child, what child
Yeah.
it is. Am I right?
Yes, sir.
Yes, so these are the areas where homeopathy can contribute a lot in
Yeah.
medical science. That's the most important.
Yes.
Ahmad Hassan, sir, what is your opinion? You are a person from the medical field. Yes, please, sir. Yes.
Thank you, sir. Really, it is natural remedies are more better than the chemical one. And second thing, there is no proper medicines in allopathic system for such type of beautiful management. And the main thing is the sir, awareness, and digital media is one of the best. I requested you before also that in daily newspapers, yani which is weekly in regional, there should be like this weeks there should be some general articles, yani, that in breastfeeding this is the, and it can be managed by homeopathy. Medicine name not written, no problem, but at least symptoms can be written. So it is a useful step for the empowerment of our holistic system of medicine. But thank you, Madam Shalini. She always, Madam respected, always do very laborious work for the presentation of hepatitis and all things. So may Almighty bless you. Thank you very much.
Yes.
Thank you, sir. Thank you so much.
Yes.
Sir, there is
Yes,
in the
please.
chat box,
Yes.
there is a someone is asking question like extra calories, like what we have to take. See, actually, in some villages, there will be some misconception, like the mother is not given food in the like in the breakfast, or the some meals are skipped. In some villages, there is a misconception of not eating the food. So it's not like extra calories, like 500 calories is required in a mother for a day. So some misconceptions are there in some villages of not giving food to the mother. So there is nothing like extra food has to be taken, or extra something should be added, nothing like that. Some misconception are there in some villages of not giving food to the mother. So the ideal calories, 500 calories should be present in a lactating mothers. That is the thing.
Yes, of course. That's also most scientific. Then I think you did give a clear dimension, the different positions. Nobody did notice all these things, but that indicates the need of professionalism in homeopathy also. Not only homeopathy but the medical field, but at the same time some other aspect, just like I mentioned, the separate otitis media. So when it is given the recommended position, naturally it will enter through the insertion tube and the child will suffer from severe otologia.
Yes.
Then the mental health about that. Then another thing is the breast hygiene. I think that was not mentioned. Am I right?
Yes, sir. Hygienic measures is very important. Like she has to take bath properly, and she has to clean the breast properly, like after the feeding, so that she may not get some fungal infection or any other infection.
Yes. So I think we must make some protocols in our dispensaries and hospitals.
Yes, sir.
In this period, you should give these medicines. From the day on itself, from the starting of pregnancy, you can I think the morning sickness, the most difficult situation.
Yes, sir.
So from there also, there we can start the medicine. Then month 1, 2, 3, 4, if you make such a work in there, that will be more beneficial for the profession. I think you have got the potential to all these things. Anyway, this is very wonderful, because I am watching our Guru and doctor, a lot of young talented persons, they are really performing well. So also our senior doctors, like Dr. Amadevi Ambadi, and a lot of persons are there. They are also doing there very well. So definitely the coming days, homeopathy. So that is why the development created by homeopathy, really making some, giving some, but the shock waves to the opposition camps. So that did annoy them. So they filed cases in court. We all know that it happened 200 years back when Hanuman did practice. They banned homeopathy. Then what at last what happened? It again grown and grown. So it is unstoppable. Moreover, our entry to the veterinary field. So
Okay.
it's stumbling, another shock for them. Then again to the agriculture field. So it develops as a total medicine, total safe medicine for ensuring the food safety, the safety of the animals, the safety of the plants. So everything can be effectively provided with homeopathy. So that is why these type of cases are filed in Supreme Court. So we'll have a discussion, detailed discussion at 9 o'clock IST. Now it's time to wind up the session. May I invite Ahmad Hassan sir to express a lot of thanks. He is very happy with hearing all these things. Sir, please.
It's the last one in chat box, like food for the lactating mother. Yeah, I'll just say, depending on the religions, also lactating mothers' food is given by their household. So depending on the religions, lactating mothers, natural food is given.
Yes, okay.
So there is no extra calories or nothing. The normal natural food is given depending on their
doctor, we have to go to second session. Ahmad Hassan sir, please express sort of thanks in 1 minute. Yes, please.
Yes, thank you very much, sir, for inviting me on behalf of IFPH and our respected honorable lecturers, participants, as well as our seniors. Umbrella, I extend happily and deeply gratitude to you, and please always share your precast clinical and as well as awareness program. May Almighty bless you. Thank you very much, madam. And
Thank you so much.
Yes, well, that was the end of today's English edition, day 1071. Hope you to meet the same day tomorrow. Till then, goodbye. And it is all Dr. Thanesh for the continuation program in the next session. Dr. Thanesh, please proceed. Thank you.
Thank you.
Thank you, Dr. Manoj.